Following the procedure, we will use a small piece of gauze with antibiotic ointment over each of the sites where we go through the skin and wrap you up with support hose. Our goal is for you to wear the support hose almost continuously. In other words, except for when you're in a shower, and you can take a shower the day after surgery and take all the bandages off, and then you don't need any further band-aids or bandages. You put the support hose back on. We want it on essentially continuously for 3 weeks. The biggest problem you could expect to have early after the surgery is some bleeding from where the stab phlebectomies are performed. That happens in about 10% of people where at one site where we've taken out a piece of a vein, it starts to bleed. Usually 10 minutes of just putting direct pressure on there with your finger and just holding it and sitting still and having your legs up solves that. We've not had anybody have to go to an emergency room or be treated with that outside of just telling them to put pressure on that. And so if you have a bleed, that is our recommendation. The support hose, if it's not worn, could result in some added bruising and problems for you with added pain. The other issue that's real significant is we don't want people doing a lot of long-term sitting after this procedure. So we actually encourage you to get out, go to work the next day, and be active. If your job involves just sitting at a chair, we want you to get up and move around at least once an hour for a couple minutes so you're actually doing some significant walking. If you're a marathon runner or you need to exercise every day, we ask that you just chill out a little bit on that and just reduce the amount of activity you do so you're not bouncing so much. Bouncing can cause bleeding and increase bruising, and so we'd really like you to have about 4 days before you're back to running, for instance on a treadmill or outdoors. We'd ask you to get on an elliptical or walk on a treadmill so that you're not bouncing so much. After 4 days, you're clear to do full bore activity in your stockings. After 3 weeks, you can be out of the stockings and really at full bore regular activity. The only other activity I'd talk about is flying, as there is such a thing as economy class syndrome where people are found to have deep vein thrombosis or clots in their legs as a result of sitting in a cramped airline space at altitude. If you are going to be flying, you need to walk frequently in an airplane. So we have had people do this procedure and go flying, but we tell them they need to walk frequently on the airplane, get up and down, and be walking while they're flying. Other than that, our patients have done very well. At 3 days after this procedure is performed, we have them come back and make certain that the vein is clotted all the way up the length of the saphenous vein. And at that point in time, then we typically will just see them 1 month later and make certain everything has gone well. Our experience has been that people are very happy with this, and we've had a high likelihood that insurance will cover this procedure. Thank you.